Welcome to my channel Nursing Medicine. Today I came with another sample station of aptitude test for the nurses in Ireland. So let's see the sample station. Your scenario is here. Mr. Johns is a 72 years old man who was admitted with a diagnosis of pneumonia 3 days ago. He has a history of angina for which he is prescribed glyceryl nitrite if required, that's PRN. And he is on antibiotics. His vital signs are stable. His dyspnea is less than when he was admitted. And he is sitting out on a chair beside the bed. After lunch, he rang his call bell and states, "I have a pain in my chest." A set of vital signs was taken and the result was as follows. Temperature 37 degrees Celsius, heart rate 80 beats per minute, respiratory rate 24 breaths per minute, and blood pressure 110/72. That's his vitals. And your question is, carry out a focused assessment of the patient's chest pain, provide appropriate nursing care, establish and maintain a caring therapeutic interpersonal relationship with the patient, document the assessment and care of the patient. So that's your question. So your question is, you have to carry out the assessment for the chest pain and you have to do the nursing care and document. That's your task. As you know, your task here is to assess the chest pain first and do the nursing care and document. So for assessing the chest pain, what all are the things you have to do? So the patient is sitting beside that bed and he has diagnosed as a pneumonia patient 3 days ago and he has angina, and for that he has glyceryl trinitrate GTN is prescribed as PRN. So all the details of the patient and his vitals are normal. So for assessing the chest pain, what you have to do first? So you have to go to the patient and you have to ask the patient, where is the pain? Where is the location of the pain? You have to ask the first thing, you can ask the location. Then you can ask any other symptoms along with the pain. Then you can ask the nature of the pain. So is it sharp, dull, radiating, or is it going to the left hand? So you have to ask the nature. And of course you have to ask any alleviating factor. Alleviating factor means when the pain is reducing. So if you are sitting down, are you feeling better, or lying down, you can ask that one. Then you have to ask the patient to score the pain by themselves. So you can tell the patient, consider a pain in a scale of 1 to 10, and if you have very less pain you can score 1, and if you have severe pain you can score 10. So how much will you score for your own pain? So you can ask the rate of the pain for the patient. So that all things you will do here for assessing the chest pain. So once you ask this all the question, that means you did assessment for chest pain. Next question is to do the nursing care. So the patient has pneumonia and chest pain, complaining the chest pain. So maybe the pain due to the pneumonia, that means his breath is 24, that we know, and maybe it's due to the angina. So we don't know what's the reason. So we assess the pain and we understood. So next thing you have to do is you have to go to the cardiacs. So what is there for him as a PRN medication for the chest pain? So as it was mentioned in the question, he has PRN GTN for the chest pain. So you should go review the cardiacs and you can give the GTN for the patient. And of course you have to assess the cardiacs for the oxygen chart. If he is prescribed for the oxygen, you can administer the oxygen. So that's what you are doing as a nursing care. And the last thing is to document. So you have to document describe the pain, the patient score this one, and this is the assessment location this one. What are the things you assess, you have to document. And you have to document you administered oxygen and you administered GTN. So that's all about this station. I hope you understood about the station. So here they just asked you they gave a scenario for the patient who has chest pain and who has diagnosed as a pneumonic patient, and he has a history of angina, and at the time when he rang the bell he's telling he has pain. So your question is like, you have to assess the chest pain and give the nursing care and document. So that's all about this station. Thank you. Don't forget to subscribe my channel and press the bell icon so that you will be notified with my new videos. Bye bye. I'll come with another station in my next video. Bye.